Welcome back. This is Garrett with Sympliact again, and this is the second video in our series where we're diving into the functionalities and options available on Sympliact to initiate or even just facilitate the sharing of pertinent care-related data across the platform. In this video, we're going to pick up where we left off in the first video, and we're going to look at the interaction that would allow a patient themselves to share the data with another provider of their choosing without us being City General Dentistry, who we looked at in video 1, without City General Dentistry even having to send a specific referral. This functionality is very, very unique to Sympliact, and it highlights why a distributed health record that is co-owned by the patient in real time is both so very different and so very powerful, both in terms of value to the patient, but also in terms of value to the practices with whom they seek care. So, as you see on the screen here, I'm on the exact same screen that we left off on in the first video. I'm still in City General Dentistry, user is Mary Jones, and I'm on that care thread that we populated. So I'm going to log out because, again, City General Dentistry doesn't really have to do anything from this point forward for this particular interaction. I'm going to change windows to bring up the patient application. In this case, this is the patient account for Beth Smith that she created after City General Dentistry entered her into their practice. So when we enter a patient into the practice, we enter their email, their phone, they're going to get notifications to let them know that they've been added, and it's going to give them a link that they can access the patient application, create a patient account, and from there participate in the management of their care. So in this case, on Beth Smith's profile button, we see that she's got a notification that she has a connection invite to review. So if she clicks on the profile button, it's going to take her to her healthcare provider screen, and it's going to show that City General Dentistry has entered her and is requesting to connect. So she can click connect, review the data to make sure it's indeed the right practice, connect, and now she's connected to their practice. So to demonstrate that connection, if I go up to her Care Threads tab on the top right, we can see that she now has access to that care thread that City General Dentistry created for her. If she clicks into that, we see all of that information. So we see Dr. Jones's recommendation. She sees that she is to establish care with an oral surgeon. She has access to the file that was uploaded to her record. And so she has everything she needs that she can now, if she chooses, take this record to any provider, any oral surgeon that she wants to, share this thread, which is what we'll look at in just a sec, and that new provider will have access to this data without, again, City General Dentistry having to do anything. So let's go back over now to the practice application, back to that landing screen that we looked at earlier, and we'll log in to Hometown Oral Surgery. So let's enter this. Okay, so here we are in Hometown Oral Surgery. I've skipped through a few steps which we already looked at in video 1, but to confirm, we're in Hometown Oral Surgery. John Smith is the user, and I went ahead and created Beth Smith in this practice. So the use case here is Beth decides to see Hometown Oral Surgery. She calls Hometown Oral Surgery. Hometown Oral Surgery enters her into their practice, and we can see that there's no information present for Beth Smith yet. So no care threads available, and it tells us that the patient's not linked. So if we go back to the patient application and we navigate to the profiles screen, we now see that Beth has a new invitation to connect that she needs to review. So we'll go through the same process. So Beth can review that new connection request from Hometown Oral Surgery. If she agrees with it, she can decide to connect, and she's going to elect to give them all records in this case because she wants to share that record that was created by City General Dentistry with Hometown Oral Surgery. So she's going to, in this case, Hometown Oral Surgery is managing their authorizations, their NOPP, and the release of information privileges through the application. So we'll click through that flow, and now Beth is connected to Hometown Oral Surgery. So if we go back to Hometown Oral Surgery now. And we're going to reload the browser here to update the data. And what it'll now show us is that Beth Smith's patient site account is now linked to Hometown Oral Surgery. And if we go to the Care Thread tab and we click on All, we have access at Hometown Oral Surgery to the thread that was created by City General Dentistry without ever actually having to connect with that practice if we don't want to, or we don't know that practice. Again, it's a practice that we don't usually interact with. The patient has the ability to connect us to that thread so that we now have access to the files, so we could download that PA and upload it to our system if we want to use it. We have Dr. Jones's recommendations. So this is one of those paths upon that foundation that we looked at in video 1, where data can be shared across the platform without actually a formal referral getting sent. The patient can take ownership of the data. The patient can then share that data with the provider of their choosing, and the patient gets the benefit of, again, not having to have new x-rays taken, not having to wait on Hometown Oral Surgery and City General Dentistry to sync up for Hometown Oral Surgery to figure out what City General Dentistry is thinking needs to occur. So, a common use case, patient is in Hometown Oral Surgery's office for the visit, and the referral hasn't gotten sent or the data hasn't gotten shared, and now City General Dentistry is out on holiday that particular day or something, and Hometown Oral Surgery doesn't have the ability to get the data, which leads to a poor patient experience, upset, frustration by the patient on both practices' parts. The other option or other interaction that occurs too is, Beth doesn't pursue treatment for 3 months, 6 months, something like that. And now if City General Dentistry hasn't populated the data at the initial interaction, which is a much quicker, easier, more efficient way of doing things, 3 months down the road, 6 months down the road, they're having to review the chart to refresh themselves on what was the actual recommendation of care. They have to track down the x-rays or any other files that they need to upload. So an interaction that now takes twice as long, 3 times as long as it would have to just upload it in the first case while everything is fresh, and then the patient can leverage that data downstream. So this is one of those paths. Again, there's other paths where we're a little more proactive, where we actually send the referral itself or give the patient recommendations. But this is a core interaction that is possible on the platform, and that, again, is a big differentiator between other ways of handling this data. So I hope this resonates and makes sense. Reach out if it doesn't, or if you have questions. Otherwise, I hope to see you in video 3, where we look at one of those other pathways to referring or collaborating on the care of a patient. Thanks, and have a great day.